Hello and welcome to this channel, where you can enhance your English listening and speaking skills by watching and repeating with me daily. I will select an article to read and assess your comprehension. Are you ready? Let's get started. But before we begin, take a look at these words. Regulatory. 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 Inadvertently. 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 Nicotine. 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 Inhaler. 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 Pipeline. 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 Officials call for faster medicinal licensing of ecigarettes, 599 words, by Mark Odell. Health officials have called for a review of e-cigarette licensing to speed up their availability on prescription after concluding they can help smokers quit. A report commissioned by Public Health England estimated they are 95% less harmful than tobacco but observed no product has secured approval to make it available on prescription in the 5 years since procedures were put in place to license tobacco replacement products. Much of England's strategy of tobacco harm reduction is predicated on the availability of medicinally licensed products that smokers want to use, said the report. It called for a review of the licensing process put in place by the UK Medicines and Healthcare Products Regulatory Agency in 2010, citing concerns the current cost of obtaining a license would limit innovation in favor of products produced by big tobacco companies. The fact that no licensed e-cigarettes are yet on the market suggests that the licensing route to market is not commercially attractive. The absence of non-tobacco industry products going through the MHRA licensing process suggests that the process is inadvertently favoring larger manufacturers, which is likely to inhibit innovation in the prescription market, the report said. Last year, a new type of nicotine inhaler backed by British American Tobacco won MHRA clearance. However, the product, Voke, is not yet commercially available in the UK and is not defined as an e-cigarette because it uses the propellants found in asthma inhalers to deliver nicotine. According to the report, BAT has submitted an e-cigarette product for approval and rival products are also in the pipeline, but it is unclear at what stage the applications are. The one-off cost of the application process is estimated by the MHRA as between £252,000 and £390,000, along with annual costs of between £65,000 and £249,000 per product. A review of the licensing process therefore seems appropriate, including manufacturers' costs and potential impact. This could include a requirement for MHRA to adapt the processes and their costs to enable smaller manufacturers to apply and to speed up the licensing process, the report said. The report also warned that new EU legislation, which is likely to come into force in the UK in 2017, would take e-cigarettes containing high nicotine doses off the market, potentially affecting heavier smokers. Among other conclusions, the study by teams from King's College London and Queen Mary London found the message that e-cigarettes are much less harmful than tobacco was not getting through to smokers. Instead, research questioning their safety has contributed to recent slowing demand. E-cigarettes are not completely risk-free, but compared to smoking, evidence shows they carry just a fraction of the harm, said Professor Kevin Fenton, Director of Health and Wellbeing at Public Health England. The problem is people increasingly think they are at least as harmful, and this may be keeping millions of smokers from quitting. Local services that help people to stop smoking should look to support e-cigarette users in their journey to quitting. There is also concern that the use of e-cigarettes would encourage young people to start smoking. The report by PHE said there was no evidence to support this. The WHO report found there were not enough data to establish whether the trends for the growing popularity of e-cigarettes in the UK and the gradual decline in nicotine use were causally related. Here are the questions, please answer it and test how you understand the content. 1. What's the percent of e-cigarette less harmful than tobacco by Public Health England estimated? 2. Whose product won MHRA clearance last year? 3. What factor has contributed to recent slowing demand of e-cigarette? For whose report last year doubted whether e-cigarettes helped smokers quit? Did you get it right? Leaves your answers in the comment below. I will show you the answers later. Now challenge yourself and listen it again without subtitle. Officials call for faster medicinal licensing of e-cigarettes, 599 words, by Mark Odell. Health officials have called for a review of e-cigarette licensing to speed up their availability on prescription after concluding they can help smokers quit. A report commissioned by Public Health England estimated they are 95% less harmful than tobacco but observed no product has secured approval to make it available on prescription in the 5 years since procedures were put in place to license tobacco replacement products. Much of England's strategy of tobacco harm reduction is predicated on the availability of medicinally licensed products that smokers want to use, said the report. It called for a review of the licensing process put in place by the UK Medicines and Healthcare Products Regulatory Agency in 2010, citing concerns the current cost of obtaining a license would limit innovation in favor of products produced by big tobacco companies. The fact that no licensed e-cigarettes are yet on the market suggests that the licensing route to market is not commercially attractive. The absence of non-tobacco industry products going through the MHRA licensing process suggests that the process is inadvertently favoring larger manufacturers, which is likely to inhibit innovation in the prescription market, the report said. Last year, a new type of nicotine inhaler backed by British American Tobacco won MHRA clearance. However, the product, Voke, is not yet commercially available in the UK and is not defined as an e-cigarette because it uses the propellants found in asthma inhalers to deliver nicotine. According to the report, BAT has submitted an e-cigarette product for approval and rival products are also in the pipeline, but it is unclear at what stage the applications are. The one-off cost of the application process is estimated by the MHRA as between £252,000 and £390,000, along with annual costs of between £65,000 and £249,000 per product. A review of the licensing process therefore seems appropriate, including manufacturers' costs and potential impact. This could include a requirement for MHRA to adapt the processes and their costs to enable smaller manufacturers to apply and to speed up the licensing process, the report said. The report also warned that new EU legislation, which is likely to come into force in the UK in 2017, would take e-cigarettes containing high nicotine doses off the market, potentially affecting heavier smokers. Among other conclusions, the study by teams from King's College London and Queen Mary London found the message that e-cigarettes are much less harmful than tobacco was not getting through to smokers. Instead, research questioning their safety has contributed to recent slowing demand. E-cigarettes are not completely risk-free, but compared to smoking, evidence shows they carry just a fraction of the harm, said Professor Kevin Fenton, Director of Health and Wellbeing at Public Health England. The problem is people increasingly think they are at least as harmful, and this may be keeping millions of smokers from quitting. Local services that help people to stop smoking should look to support e-cigarette users in their journey to quitting. There is also concern that the use of e-cigarettes would encourage young people to start smoking. The report by PHE said there was no evidence to support this. The WHO report found there were not enough data to establish whether the trends for the growing popularity of e-cigarettes in the UK and the gradual decline in nicotine use were causally related. Did you understand all of it? Let's move on to the next video. Still not getting it? How about listening to it again?